Hey everyone, my name is Rebecca Cocott, and I'm a senior here at the University of Florida, majoring in health education and behavior with a specialization in community health promotion. Today, I'm going to be discussing Greece, a little bit about its background information, about its system, their culture, and most importantly, we're going to discuss their healthcare system and how it's been operating and how it's currently operating. When we think about health issues and those in need, I know we wouldn't typically think about a place like Greece, which is why I thought this would be a good presentation to discuss, because even though on the surface area we see beautiful coasts and beaches and architecture and history, but internally there are a lot of issues that are going on currently with their health system. Before we delve into these health issues, it's always important to understand the area we're discussing and kind of looking for some brief determining factors that might lead to some of these issues. So Greece is located in the Balkan Peninsula, and it's actually located between Asia, Europe, and Africa. The population is 10,702,000, and the capital is Athens. That being said, the primary language is Greek. Some other languages that are spoken, though, are Macedonian, Albanian, Turkish, Armenian, and Bulgarian. This makes sense due to the geographical location of Greece and the people who live there. You know, it has a very broad area to cover. Greece's political system is unique to ours. And for instance, when they elect a president, the president isn't the one who's carrying out executive power. The president for Greece is more of a, think of it like a action symbol. So they're elected for 5-year terms by parliament. And that being said, Greece's political system is a parliamentary republic. And the prime minister and the council of ministers are the ones who are holding the role of executive power. So they're the ones who are actually carrying out decisions. And the president itself is more just to sit and represent the people as a whole. So every country has their own cultures and customs that represents them, and it kind of gives us an idea of how they operate as a region. For Greeks, religion is going to play a large role in their daily lives, and they don't really do things that go against their religion. In fact, a lot of Greeks are involved or have a position in their local churches, and they're known to be an Orthodox Christian nation. Greeks also heavily believe in superstitions, such as the evil eye is the most common one, spitting, black cats causing bad luck. These are just to name a few. I know the evil eye, some might be familiar with it in terms of jewelry, or I've seen it on dream catchers or some sort of decor to go in your house to protect against spirits. This is just embedded in their culture, something they heavily believe in day-to-day life. If you don't know what a superstition is, an example is the saying, step on a crack, break your mother's back. Essentially saying if you were walking and you were to step on a sidewalk crack, you could in turn break your mother's back, just to give a better idea. So, Greeks actually has a really large issue with income equality, and this has led to the highest poverty rates in a long time for this area. And according to the Hellenic Statistical Authority, about 3,043,869 people, which for some background knowledge is about 1/3 of the Greek population, have faced the risk of poverty and social exclusion over the past year. This could be in turn because of the pandemic that's been going on for about 2 years now, but however, Greece does have high income levels with a GDP of 189.49 billion in 2020. In terms of the healthcare system itself, it's primarily made of private voluntary healthcare systems. Greece is also a part of the national health system, and the entire population also does have a social insurance, just to give an idea. So mainly private voluntary funding is where their health care is coming from. In terms of life expectancy and fertility, Greece has a typical life expectancy, which is 84.5 years for females and 79.5 years for males. Women are typically known to have a higher life expectancy rate, as men are more likely to partake in riskier activities that could lead to premature deaths. However, the fertility rates are already low, and they've been steadily decreasing for a few years now, but they're expected to continue to decrease based on different theoretical models. That being said, the fertility rate in 2021 is 1.279 births per woman. Now we can discuss burden of disease. And although Greece may not have many deaths due to communicable diseases, their highest causes of death are a result of non-communicable diseases, which are preventable. These diseases are heart disease, stroke, and lung cancer. Prevention methods and health programs implemented could eliminate the risks of these diseases. Not to mention, death and disability were highest for those who had diabetes or Alzheimer's. Risk factors among Greek population include tobacco, high blood pressure, high fasting plasma glucose, and high body mass index. These were the top 5 ranked. This is the country that can get a handle on their causes of death and risk factors if they just had implemented the right health programs. Not to mention, having health education programs are also a really good form of prevention, which in turn could bring these causes of death to virtually nothing. Now we could talk about public health programs that they have. As mentioned previously, in terms of the Greek healthcare system, the national healthcare system, which we're going to refer to it also as ESY, has a really big part in handling insurance, as well as setting the goal of ensuring free health access and quality health services for all residents. This can also include some private as well as public health providers. So the Stavros Niarchos Foundation created a health initiative whose overall goal is to strengthen the Greek healthcare system. This kind of goes hand in hand with creating quality healthcare for all residents. And since the implementation of this program, they've worked on infrastructure projects, equipment procurement, educational programs, as well as mental health care for children and young adults, which I honestly found that quite interesting due to the fact that their mental health care is more of a new understanding for a lot of people who back in the day, maybe their parents or their grandparents didn't really believe in it. So I find that really amazing that they're starting to have services for children and young adults. They've also given multiple ICU units and 5-year health program for nurses and doctors, and high dependency units to over 15 hospitals. This is all their efforts so far to support the country throughout the pandemic. So, health policy. In lighter news, Greece is expected to remain on track for their goal of lowering mortality for some of their high-risk, non-communicable diseases, which include the heart disease, cancer, diabetes, and chronic respiratory disease. Some of these were in the top causes of death for the Greek population in 2019. Other goals of the Greek healthcare system is to increase life expectancy at birth, which is reduce infant mortality, reduce health inequities, which can be financially or physically, enhance well-being, and aiming for universal health coverage for all. Some challenges that might lead to getting in the way of achieving these goals are finding cost-effective ways to provide health and education, access to healthcare, and trying to recover from the financial crisis that inflicted permanent damage to the people of Greece. Systematic tax evasion was something that played a large role in the structural problems that led to Greece not paying the IMF, which is the International Monetary Fund. They owe them 1.6 billion euros. This resulted in debt for the country, and where there's debt, there's usually a lack of healthcare that follows due to increased poverty, which we can see here, especially with combination of the pandemic. So now we could talk about the growing health crisis. So Greece is in a downfall, and the ESY is struggling to find a means to afford healthcare due to the spike in poverty that's been occurring. And this spike in poverty is mainly due to the pandemic, which has not only caused millions of deaths worldwide, but it has pushed so many others below the poverty line, especially those who were already struggling to hang on to it in the first place. The lack of patient visits and transportation also has the pandemic to blame. In attempts to reduce physical contact, especially in crowded places, this has caused people to stay at home. Even certain doctors' offices that were open, a lot were not seeing patients in person. And for those who don't have access to internet or a computer in general, this would be very difficult to meet over means of Zoom or some other video chat platform. Some cost-effective solutions would to be creating preventative measures such as health education programs, An example for a primary prevention is to receive a vaccine or limiting tobacco use, which are both ways that can prevent a health issue arising, and thus preventing any extra measures that would normally need to be taken. Luckily, in terms of funding, the Starvos Foundation has done a great job at attempting to battle the health crisis of Greece. And if they continue to do what they're doing, they'll be able to fulfill these cost-effective solutions and overall lead to better health. So, people who can help. A lot of times when we consider of who can help and who can't, we usually think of people with licenses or PhDs or any kind of degree. But in turn, being your own advocate and being an advocate for others could also be enough to really push someone to the right programs, which that could be health education programs or anything of the sort, or getting them into a good school system. And aside from smaller scales, voluntary private insurances and the SNF Foundation will have the largest impact if we're going to be looking for real change within the system. As mentioned previously, the main goal right now for Greece is to focus on those who have fallen below the poverty line and make sure that everyone, regardless of their status, is receiving the healthcare that they need. I'm sure a lot of people, especially people below these poverty lines, are having a hard time trying to get on their 2 feet, but hopefully foundations like this and the healthcare private voluntary insurances will be able to bring it back. Here are the references that I used. If anyone has any questions, please feel free to reach out. And I'd just like to take a minute to thank you for listening to this presentation, and I really hope that people learned something from this. Like I said, I know it's something that you wouldn't normally think of if you're thinking of health issues because Greece is known to be such a beautiful area, but really everywhere has their own issues. Luckily, and hopefully we'll be able to get a handle on this. Thank you.